The dream of starting a family doesn't always come easy. In fact, around 1 in 8 couples have trouble getting and staying pregnant. It's why we are so lucky to have right here in Columbus, Ohio Reproductive Medicine, a renowned fertility center. And I have 2 of their incredible doctors joining me as well. So thanks for having me.
Of course.
Thank you.
Dr. Rossi, I want to talk to you about the center and about what you offer here.
Yes, so this is our new office, and we moved here in January of 2022. And we had been in practice for many years, started by Dr. Schmidt back in like 1985. We offer in vitro fertilization, preimplantation genetic testing, embryo freezing, egg freezing. All of our embryos are kept on site. And so we offer the newest technologies that are available to patients for reproductive care.
So Dr. Schmidt, what do you think makes ORM so special? What do you think makes it different for families?
Well, I think, as Dr. Rossi said, everything is incorporated in one place. I think our efficiency has gotten to the point where now with the new technologies, hopefully within a year, you can have most people achieving a pregnancy.
And Dr. Schmidt, when should someone consider seeing a fertility specialist?
General rules are if you're under 35 and have been trying a year, if you're over 35, then maybe 6 months, and we ought to at least have an initial consultation.
And a couple of patients who considered it and then made that visit a reality shared their stories with us today. So we're going to take a listen to those.
We had been trying to conceive on our own for a little over a year. We quickly found that we had no reason why we shouldn't be getting pregnant on our own. And we did 6 IUIs without any success. And so we ended up moving on to IVF then. I felt like it was my fault. Even though there was nothing pointing it to being either of our problem, I felt like I was letting him down. We took that afternoon off from work because we knew we were waiting for the phone call. And they called and they said we were pregnant, and we'd never been pregnant. It felt amazing. We have a 4.5-year-old Zayden, and then my 2.5-year-old Zeke. Then we decided to try for baby number 3. And so now we're having a baby sister.
Well, Prey, she's somebody who has been through multiple types of treatments, and she has always had this positivity in being able to restart.
When you actually look up and realize the stats of how many people do experience some form of infertility, it's staggering. They really do want you to feel comfortable, and they want you to be successful. They want you to get that baby and complete your family the way you want to complete it.
I think at ORM, we try to be mindful about infertility treatment journey and be conscious of the cost and benefits of every intervention that we do. The best for us is always to see when they have a baby, because nobody comes here to have eggs or embryos. We want, of course, right? People come here to take a baby home.
I never originally planned to be a mom. The thought of being pregnant was terrifying. But when I met Allie, just that love that grew, wanting to start a family, it just made it clear that I am meant to be a mom. ORM was where we were meant to be, and working with Dr. Kennard, just getting that education.
They definitely were we're going to make it happen kind of team.
They are such a great couple. They're so supportive of each other, so in love. And you really want to see people who have that kind of approach to each other and to having a family. That's who you want to have children.
I also think as a same-sex couple, come to ORM. Every doctor we dealt with was very inclusive and accepting, and they made us feel just as worthy of starting a family as anyone else.
I think that people who don't deal with infertility don't know how hard it is. And I would just encourage people to just make the first step to getting information.
To put it into words is just too hard. There's not words for it.
Everything that we did to get to this point, it was all worth it.
Dr. Rossi, hearing these incredible stories, seeing these success stories from these patients is really a testament to the great work you do here. So what do you want people to know about ORM and how you help make these dreams a reality?
Well, I just want to make sure that patients understand that they're always welcome to come and meet with us and have a consultation. Sometimes patients are scared because they're worried about the treatments or they're worried about the cost of treatments. And sometimes just sitting down and talking with us makes them feel so much better. I think we have a very comfortable, supportive staff here, and I think that's one thing that makes us different.
And you can, of course, just call the office. You can go to ohioreproductivemedicine.com, as we all know, and start your journey. Doctors, thank you so much for having me in today.
Thank you very much for having us.